The 1930s in America, a time period that I'm sure most of you remember learning about in your high school years. Nazi Germany was one of the most infamous areas for history in this time period, mainly because of the event that we all know of called the Holocaust. According to the University of Vermont, the American eugenics movement had influenced several laws and regulations that caused this horrible time of butcher and slaughter. Nazi Germany had referred to this movement as racial hygiene. I'm not here today to talk to you about the Holocaust and the horrors that came with it. Instead, a movement that started many years before the Holocaust and still has intentions of happening today. Eugenics. Now there's a word that we almost never hear. Why is this, you may ask? Probably because the word eugenics has so many horrors that come with it. Eugenics is defined by the Oxford Dictionary as the science of improving a population by controlled breeding to increase the occurrence of desirable, heritable characteristics. Does this sound a little too perfect? Probably because it is. Blonde hair, blue eyes. Smart, not smart. Today, I would like to inform you of one of the procedures performed in order to achieve this proclaimed perfection. The procedure being the forced sterilization of the mentally ill. Let's begin by talking about what sterilization is. Sterilization is defined by the University of Minnesota as surgical methods that make a person incapable of reproducing, also known as not being able to have a child of your own. When exploring the surgical methods for a female, we can see two types of surgery. One is known as tubal ligation, also known as getting your tubes tied. In this surgery, the fallopian tubes, which are the organs within the female anatomy that are able to allow eggs to pass from the ovaries to the uterus, and it involves tying, cutting, or blocking the fallopian tubes. The second surgery is known simply as a hysterectomy, where the uterus, where a baby is harbored inside the anatomy of a woman, is extracted and removed altogether. When we explore the sterilization procedures for a male, there's the ever-famous vasectomy, which is the severing of the vas deferens, which are the tunnels in which sperm pass from the testes outside of the body in order to reproduce within a female. The second procedure is known as castration. And castration is just the removal of testicles as a whole. Surprisingly enough, there are people who opt to have this surgery voluntarily. Castration, tubal ligation, hysterectomy, and vasectomy alike. Unfortunately, there are so many people that do not have the luxury of choice in this matter. When it becomes mandated that these people have these surgeries, it is known as compulsory sterilization. The primary victims of this are primarily people who reside in group homes or mental hospitals or asylums. Next, we'll look at the type of people who become unwilling candidates for compulsory sterilization. The mentally ill community consists of several elements. Schizophrenia is one of the main ones. It is defined by Medline Plus as a mental disorder that makes it hard to tell the difference between what is real and what is not real. Symptoms of schizophrenia include hallucinations, delusions, isolation, having sensations in your body such as a burning sensation that's not there, feeling as if you are being pricked or stabbed by needles, hearing voices that aren't there, and so on. Bipolar disorder is another popular diagnosis amongst the mentally ill community. It is defined by the National Library of Medicine as a condition in which a person has periods of depression and periods of being extremely happy with being cross and irritable. The happiness is almost like a euphoria that many cannot figure out as to why it doesn't feel so right. In other words, you might hear people saying, "I just feel too happy today." Symptoms of this disorder include mood swings, poor judgment, and unstable sleeping patterns, which eventually lead to insomnia. Both schizophrenia and bipolar disorder are suspected to be passed down through genetic and heritable traits. This is the reason as to why this surgery makes so many victims among this community. because of undesired heritable traits. A recent case reporting a Boston woman in 2011 was a mandated sterilization in the case of a woman simply known as Mary Moe. Mary Moe was diagnosed both manic depressive and schizophrenic. According to the National Council on Disability, Mary Moe, who at the time was pregnant and had been told by the Massachusetts Department of Mental Health that given her present mental health condition, she should abort her pregnancy and then undergo a sterilization procedure. The intentions of this sterilization procedure was to ensure that an episode like this would never happen again, and she would never have to endure the heartbreak of having to abort or give up a child. Of course, Mary Moe had also had a previous abortion beforehand, and after this abortion had suffered a psychological episode, putting her in a pit of depression and anger because of the guilt she had felt. As expected, this mandated procedure that Mary Moe was informed about, she had declined. She stated that she was a very Catholic woman, and that having an abortion and a sterilization would infringe upon her religious rights, and she was in no way willing to go through with it. Despite the protest of Mary Moe, the courts of Boston, Massachusetts had still insisted, with no regards to her religious feelings. Ways in which the Boston court decided that they would get Mary Moe to have this surgery was through coaxing her, enticing her, and bribing her through ruse. Thankfully, the decision to have the surgery performed on Mary Moe was later overturned, but the stress of possibility still remained. The mental health community doesn't just consist of bipolar, schizophrenic, depressive. It also consists of people who have so terribly been dubbed feeble-minded. Feeble-minded individuals may include those with intellectual limitations, such as mental retardation, dyslexia, and dyscalculia, and also people with social disorders, such as autism, or the ever-popular dubbing of Asperger's syndrome. Again, there is in fact a documented history of sterilization of the quote-unquote feeble-minded. In the year 1927, a woman by the name of Carrie Buck was an institutionalized woman whose mother was institutionalized as well. Her mother had been deemed feeble-minded, and Carrie had as well as a result. I have a picture that I'd like to show you here today. The woman you see here is Carrie Buck, who was a victim of sterilization. The woman next to her is her mother, Mary Buck, who was dubbed feeble-minded. These two women had been subjected to some of the most horrible treatment you could ever expect in a mental asylum. At age 17, Carrie Buck had been raped and impregnated at the Virginia Colony for the Epileptic and Feeble-Minded, where she had been committed. Carrie had then given birth to a baby girl named Vivian. In the picture I have right here, you'll see a nurse holding the little baby Vivian. Unfortunately, due to the paranoia of heritable traits, even though Vivian was just 6 months old, the institution had still dubbed her feeble-minded because of the status of her mother. According to an article in the Natural History magazine, Oliver Wendell Holmes, who had ordered Carrie's sterilization after the birth of her daughter, defended his order for the surgery by stating that 3 generations of imbeciles are enough. This statement implied the desire for births that could be declared non-deficient, aka smart babies only. In light of the cases I have just shared with you, I'd like to move on to the pros and cons of the procedure, because there are some. When exploring the advantages, there are a few at least. The one obvious one is the worry of unwanted pregnancies seems to dissipate altogether. If there are no reproductive organs, there are no babies to be made. The other advantage is the elimination of any sort of paranoia of passing on these proclaimed heritable traits, such as bipolar disorder and schizophrenia, as mentioned before. The cons list tends to be a bit more extensive. For one obvious reason, compulsory sterilization deprives a human being the right to decide what happens with his or her body, many of these victims being women. Despite mental or physical ailments, this right has harmful effects when infringed upon. Secondly, like many surgeries, this procedure has many risks. To the world's dismay, careless physicians do in fact exist. Faulty surgery performance can lead to internal bleeding, infection, pain, and death in some cases. A specific complication that can arise lies with tubal ligation, the complication being ectopic pregnancy. Ectopic pregnancy is defined by Mosby's Pocket Dictionary as an abnormal pregnancy in which the conceptus implants outside the uterine cavity. In layman's terms, the baby grows outside of the womb. In most cases, the child does not survive and barely grows to 20 weeks. Surgery is required in order to remove this underdeveloped fetus. In other words, the surgery of compulsory sterilization can just lead to another surgery in the future. Another disadvantage to the procedure is that the protection from sexually transmitted diseases is non-existent. This procedure can induce so much promiscuity in young men and women. Knowing that you have freedom from reproducing any child whatsoever, well, can create a lot of impulses. Also, the risk for STDs and the transmission of them is on the rise because of this. Many people think that just because they can't get pregnant means that they can't do any harm. Many of you may be wondering as to how this is relevant to you, or anyone for that matter. The American eugenics movement is done. It's over with. Things are being outlawed, right? Wrong. Things are still happening. People still advocate for this. Think about it. How many people do you know who are being or have been treated for some sort of depression or anxiety? Any emotion you feel seems to have a different prescription and diagnosis to it. I have been witness to people mourning the death of a loved one who go to seek advice from a counselor and so drearily walk away with an orange bottle full of pills and a diagnosis. These are the same diagnoses that prompted the movement of compulsory sterilization, aka the American eugenics movement. I am not trying to convince you that a diagnosis of depression or anxiety is invalid, as if the diseases don't exist. There are, in fact, many people who are so unfortunately afflicted with these diseases. I am informing you that the privilege of diagnosis is, in fact, abused by many physicians and healthcare providers. You also may be asking yourself why I have spent so much time speaking to you of compulsory sterilization when I am focusing so much upon the aspect of the mental disease that can cause people to want to commit this act upon others. I have because of what a drastic measure it is to take in order to perform compulsory sterilization based upon a mental infarction or an emotional disorder. The American eugenics movement did not take long to start whatsoever, just within a few years. Looking at the differences of one another, whether one person gets upset at one thing or gets sad about something else, was instant grounds for diagnosis and could not be a part of the human race, therefore creating imperfection in the eyes of government and psychiatric officials. To base a movement upon a flaw and the strength that comes with the influence of this movement is way too great. What I hope for all of you to take from this presentation today is the thought of possibility. The possibility of the harm that can be inflicted through the paranoia of perfection. About how your next bad day could earn you a potential diagnosis with a remote chance of losing your right to create human life. Please, be an advocate in the differences in intellectual and emotional influences the human race has had bestowed upon them. Stand up for the people like Carrie Buck and Mary Moe. People like Carrie Buck and Mary Moe had no voice. Granted, they were part of a time period where women were frowned upon. But still, there are many today that cannot find their voice. Be a good friend to them. Speak up for them. Let them know their difference is okay. Advocate for life. Please do your part in the prevention of a second eugenics movement. Stand up, speak out, and embrace the differences of your fellow man.